I'm with Edmond Shehedah from Basha. Now, Edmond, what is Basha?
Bethlehem Arab Society for Rehabilitation. It's a center to make rehabilitation for disabled people who get all kinds of disabilities, from physical to mental to multiple. The home started in almost before 1960. It was a Cheshire home in the beginning. Then a local board took over in the 75, and the local board started developing it as a hospital for rehabilitation. We started building the center in 1982 on the land which Leonard Cheshire donated to us to build the rehab center. For building it, it took us more than 30 years, and still we do more and more working, because we develop at any time when we have money, when we can raise funds to develop the same philosophy of the BSR and the vision, which is inclusive society for all, and to provide quality health care for all people, regardless of their religion, of their political affiliation, and class. We work rehabilitation at 3 levels. The center, which became a national center in Palestine and very well known in the region. Intermediate level, we work with other hospitals to send the patients, if they need follow-up in their region, they can be followed up. They don't have to come always to Bethlehem. And the third one is the community-based, which is a very important program for us, which has 3 components. The first, empowerment, advocacy for the parents, for people with disabilities, about their rights and how they should get access to people, and how to change the policies of the government and the people accepting the disabilities and the employment. And then we created a community daycare centers by the people to create their community center to make integrated school, integrated learning, disabled people with non-disabled people in the camps, in the villages. All is done by the people. We, BSR, continue to give them technical support and treatments free of charge, depends on their income. The third one is the outreach program, which we have a team who goes out in remote areas where discover disabled people, where we treat them. If they need food, they give them. If they need technical assistance, we give them. If they need hospitalization, they give them. So we covered all the Bethlehem region. Now we start working in Hebron area, and newly we started working in the north. Now communities come and they ask us to work with them. So when the people come ask us to work with them, that means they are willing to help their people. They are more committed. We never go to people. People come to, and we tell them from the beginning, we don't have money. We have to work on ourselves, and you have to look for money. And we have been successful to build more than 14 schools. And each school, the community raised $500,000. Wow. And you can go, and from few children, 250 to 200. From 1 teacher, 15 teachers. So the empowerment of people is very important, and give the right to people to think and to develop the way they want. Because rehabilitation is not a Bible. Each one has the concept of rehabilitation, but the basis should be respected of rehabilitation. And this is how people develop and how we can reach people.
What is your vision and your mission here?
My vision and mission to have an inclusive society without any discrimination to all people, and I would like everybody to have access to quality healthcare without any barrier.
You have rehabilitation here, so what departments do you have here in the hospital?
We have the medical department, the surgical department, The rehabilitation departments, which consist of doctors, nurses, physiotherapists, occupational therapists, speech therapists, psychologists, psychiatrists, special educators, job placement, advocacy. We have all these people, all these departments.
Now, two departments that you have the vision rehabilitation and audiology section. Tell us a little bit about those.
The vision rehabilitation is people who are suffering from low vision, and unfortunately there were many hospitals here working for so many years, they never did it. I work for the people, I don't work for money. Because this doesn't bring money, I don't want to have it. But low vision is very important, but because sometimes children are born, they have low vision, they are not detected except at the age of 10, 12 years. Sometimes in school they are not detected. Now we have a low vision program. We work with early detection. We work with the government for 5 years to include them on the public schools and to have technical aids. We are fighting to get funds to give these technical aids for poor children to be inclusive in the schools. And the government is taking that seriously, and a change is coming for the low vision people. For the physically, they've been always integrated. We worked a lot on them. It's much easier than low vision than hearing impaired. There is still a lot to be done for the total inclusion for hearing impaired and low vision people.
Do you have the same people coming back again and again?
Oh, I have people for 30 years coming back. 30 years. People that meet in the street, oh, you don't know me, you treated me, I'm working, I'm going, I'm happy. No, what I'm proud of, the people who came here, they are still committed to the society. They talk about it, how good, because they felt their life has changed. And they never forget you. If you touch the people in their lives, they always recognize what you have been doing. And if you go everywhere in Palestine, they talk about BSR.
Tell us a little bit about your community programs.
My community programs, as I told you from the beginning, I don't want to repeat myself, is done in the community at the 3 levels. First, at building community centers, empowering people, disabled people, organizations of disabled people, how to fight for their rights, because these, and the outreach we are mobile clinic where we see them, we give them technical aids, we give them injections, medical, if they need that, transfer to the hospital, or we transfer to another hospital near them. But the most important is to work so much to influence the government in their policies, is poor people, disabled people, elderly people should get access to health care free of charge, without barriers. This is my dream. And then to work on a real social security. That means if we work on this social security thing, people have retirement, they can live, they stop immigrate, and all this is very important. Donors, they give money for political purpose. They say it's development. I don't think it's development. It's political. Sign this paper, you get the money. No. Give me, let me build myself. Because when I have confidence in myself, I can build the bridges of peace. I'm not afraid of peace. But if I am poor, I have nothing, what can I do? Who's going to listen to me? So this is why the community is the most important thing to take care of, because they are going to do the change, not the politicians. They influence the politicians. And this is what I look for.
Do you teach awareness?
Yes, we teach awareness, definitely. We teach advocacy. We teach a lot about sexual abuse for children. Now the child can defend himself. And we have the society, child protection. We have protection for women, battered women. All these we do it in the hospital because we want to teach people their rights, even in the medical care.
Now you've won many awards. Tell us about the awards that you've won.
Awards? I didn't win much. I only won the Peace Award for fighting for disabled people. And I have a girl, she's very active. She lost her vision a long time ago. She's director of a project. She's Rima Kanawati. She's an excellent woman. This is why in this hospital we have 18% almost disabled working here, to show people, these people are better than anybody else. It's not, don't judge on appearances. Judge on things which you see. Don't prejudge. This is again a lesson which I teach my people. So I don't see disabled people myself. I don't. We are all, because everybody of us has disability. You have a backache, you are disabled. So why should I don't see you as a disabled? I see you're a good man. No, you are disabled. You cannot walk. So like somebody who has a wheelchair, he can run. You cannot run now yourself. So these are the philosophies which I teach people. So to mentioning you, but this is a small setting, no problem. But to tell you the difference, you don't have to judge. You don't have to judge on appearances. You don't judge on what you hear. Talk to people, listen to them, and you find the solution.
Do you get many letters coming from patients who...
Yes, many thank you. Sometimes I get complaints too. Not only thank you letters. I get both, but mostly good things. Look, every time I do around the hospital in the morning, I only hear compliments about my nurse and the care. I said, I don't want to hear that. Tell me your complaints. Because this is what I want to know, to approve. We are not perfect. Very rarely I get complaints. People that complain, they don't want to pay, might be. They want to complain, to reduce the price. This is okay. But no, really, it's a good place.
Are you making a difference in the community?
A lot. And look, first I have to thank my people, my employees, who are very committed. Very committed. We get low salaries. We're not, still we are fighting for increment with my board. But still we don't have, but they are very committed. And I'm proud of them. We are family. We are family. I'm a big boss in my office. Outside, I'm like them. So this is what they are near me. If they have problems, they come discuss it with you. Even family problem. I'm their father or their grandfather. So this is what it is. We are not running a really business hospital. We are running a humanitarian where we all share. I have my people who paint this my office on Saturday. So I encourage volunteers. Even with merchants, I debate. I reduce the prices. Nobody can imagine the price I get. So this is my job, to save money. So this is what I do. If I take commission, I will not save money. If I cheat, I don't save money. But honesty always pays.
And what's your prayer for the hospital for the future?
That will continue with the same mission, to be open to all people without any discrimination, and to help people who are in need all the time. And this is my dream, to continue this work. And I'm sure God will this place, and He will continue. I'm sure He will continue.
Okay, Edmond, thank you very much.
Thank you.